So we have Avi, who is from Meditouch, and Avi's a physio. So I thought we would just bring him in to talk about the product and talk about how the product is being used in Europe, in the US, and how they are utilizing biofeedback system in the home environment to do also tele-rehab therapy with their clients. So I might just hand it over to you, Abby, and let you get started. You've got your screen there shared, and take it away. And I'll mute myself.
Okay, good evening, everyone. Evening there, here is good morning for us. My name is Abraham Cohen, Clinical Director of the company, and here is Alan Waterman, Product Specialist of the company.
Hi.
And we are glad to present you this presentation about physical rehabilitation using movement biofeedback. That's the subject of this meeting. A little bit about the content, what we are going to talk about then. First of all, a little bit about introduction, scientific background behind the system and behind the concept of the system. A series of short movies demonstrating the system, how they look like and how they work in general. And then we have a series of the short videos about clinical applications using the system in general, how we can use these devices. And everything is okay? The sound is okay for you and video?
Yeah, all good.
Okay.
Yep.
Okay, and then we are going to talk about evaluation documentation by the system. Then we have a series of videos about case studies using the system, patients, different kind of diagnoses and problems that use the system. And then we talk about system clinical features, and at the end we talk about telehealth and HEP, and at the end conclusion. Okay, let's start from introduction. As we know, and it is well known in the literature, that there are 4 main elements in rehabilitation to get maximum rehabilitation outcomes. The first one is objective evaluation, as we know that to do some objective and quantitative evaluation of the patient ability and like biomechanical parameters like range of motion, speed of movement, and motion analysis. And the second one is customized practice, how we can do customization of the practice in regards to the level of practice and the kind of practice according to the patient abilities and needs. And of course, intensive repetition, that it is very important because without intensive repetition, there is no motor learning. And the fourth is feedback to get better motor learning and to help the patient how to get better recovery. And of course, the very important factor that is can help us to move all these elements is challenge and motivation. That if there is no challenge, there is no any movement of these elements. Okay, let's start from just a second. Let's start from the challenge. Here we have a movie that shows the very brief time how they use the challenge and fun into the regular daily activities like going down and up the stairs can make this boring task to very attractive task almost for all ages. Let's see together with this video. And this video is part of the study that has been conducted in Stockholm in 2015. Okay, I think it's clear for you. Let's go ahead. I think it's clear for you that fun can make the attractive, a very boring task like physical or occupational task, very attractive task for getting more repetitions and intensive practice. A little bit about the feedback is also well known, and you know that by feedback you can get more ability to the brain to understand its ability and to move, to do how it can impair itself. You can give feedback, visual feedback by the games and by in the form of the games, or verbal cue by the program to patients about his abilities to get better, to improve perception and the sensor integration. And the second one, the third one is the method of the rehabilitation. Although the system is not a robotic system that can move passively the joint or to do some assisted activity, but by combination of hands-on and giving feedback, motion feedback, we can do practice in all stages, starting from passive movement till active movement, very high resolution of the active practice. And the last one is the objective evaluation that the system can provide, say, objective and quantitative data about biomechanical parameters of the hand or elbow and knee, like range of motion or behavior of the movement, speed of the movement. Now, a little bit about the research and about the studies that have been conducted till now about the system. The first one is hand tutor enhanced hand rehabilitation after stroke. A pilot study that has been conducted about 10 years ago. Here you can see a video about the patients before the treatment and after the treatment. And of course, if you are interested in more details, you can go to the PubMed and you have the link for getting much more information about the research. Another study is the biofeedback in general. That is the basic of the system, because the system is based on this concept. That is conducted in your country, in Sydney University, that biofeedback improves the activities of the lower limb and after stroke, a systematic review. And the third one is efficacy of the compression gloves in rehabilitation of distal radius fractures. That the system has been used as the measuring system to measure the range of motion of the hand and as evaluating the tools in this research. Now let's see together some videos about the system. The first one is a hand tutor, that is ergonomic glove that has 6 sensors, 5 sensors for each finger and 1 sensor for the wrist joint, that enables the isolated movement of each finger or wrist joint or combination of them together. Here we can see a video about how it looks and how
the hand tutor is an ergonomic device which is very quick to put on, even if the patient has deficits in their range of motion. This is achieved because the hand tutor is put on to the patient's fingers rather than the fingers being placed into the glove. Once the hand tutor has been fitted, exercise practice can be facilitated of the fingers and also of the wrist. So here we see a flexion and extension of the fingers, and an extension and a flexion of the wrist.
Okay, this one for the system, how it
The combination of both finger flexion and extension can also be achieved and coordinated with wrist extension and wrist flexion.
Okay, now let's see another video about the clinical application that we can use this system for different kind of clinical applications together.
By adding additional modalities, functional practice and task-based practice or task-specific practice can be achieved. Again, the exercise is customized to the fingers which are going to be used to facilitate this functional practice. Here we're using a grip movement, a tip-to-tip grip movement of the fingers around the fork and an extension when we're opening. All this is achieved and facilitated with the movement biofeedback. Here we're looking at a tripod functional grip. We can change sizes and change objects to increase difficulty or decrease difficulty, depending on our treatment goals. Here we're doing a grip and extension exercise of the club. Here we're doing isolated opposition movements without an additional modality. Here we're doing a full grip and coordinating it with elbow flexion. And then extending, and then once again gripping the ball and bringing it towards us with elbow extension. This practice is timed within the movement biofeedback. We can further increase difficulty by increasing resistance modalities. Again, this can be achieved by functional grip or individual fingers. And here we're doing a pinch movement with an object to make it class-specific practice.
Okay, now about the arm tutor as another device for upper limb rehabilitation. Arm tutor enables to detecting and treatment shoulder movement like extension, flexion of the shoulder, abduction, adduction, and internal external rotation, and also elbow extension, flexion. Each of them or one of them and with another one together as a combination of functional tasks like each hand or hand beyond back or hand beyond neck. Yes, let's see together how it looks like.
The arm tutor is very quick and easy to put on. This is very important so that the client and the patient can begin the exercise practice as quick as possible within the session. Movements that can be facilitated with the arm tutor include abduction and adduction, as well as forward flexion and extension, in addition to external and internal rotation. In addition to flexion and extension exercises of the elbow.
Okay, let's do together a clinical application using the system now.
Because the arm tutor is an ergonomic device, it can be used to facilitate practice in a lying position. You see that the patient was doing extension and flexion of the shoulder. Here, the patient is doing internal and external rotation exercises. The feedback is positioned in a position so that the patient can clearly see this. Here, we're looking at coordination of joints. We're looking at forward flexion and extension of the elbow at the same time. And now we're looking at abduction and adduction exercises. Here we're looking at a straight arm abduction and adduction exercise. And here we're looking at extension and flexion of the elbow. Again, these movements are controlled and precise movements. Different additional modalities can also be added. For instance, here, the patient is working against resistance. So we're working more on strengthening of the flexion of the biceps. Here we're looking at forward flexion against resistance.
Okay, another one is leg tutor for lower limb extremity, lower limb rehabilitation. Let's see together about the device and then clinical application.
The leg tutor is an ergonomic device that can be easily and quickly put onto the patient. It is connected to the PC with a USB cable. Once in position, the leg tutor can be used to facilitate exercises of the hip, including abduction and adduction, forward flexion, as well as internal and external rotation in a standing or sitting position. Knee movements can also be done, including flexion and extension.
Okay, now let's see about clinical application, how we can use the system in clinical.
All exercise practice can be done in lying or sitting position. This here, we're looking at customizing repetitions of a controlled flexion and extension. Here we're looking at controlled abduction and adduction. All this is achieved using the movement biofeedback. So the patient is given instructions to the speed and range that they have to achieve the task. Again, all the movements can be translated into the movement biofeedback to customize and motivate the patient to do repetitions of controlled exercise practice. Being a wearable ergonomic device, the patient can be asked to do practice exercises in a sitting position and a lying position. Here we're looking at pelvic girdle strengthening, again using the movement biofeedback as a guideline to the speed and range of movement. Additional modalities can also be introduced into the practice to increase the difficulty of the exercise practice. We're looking here at working against resistance. Again, the speed of the movement and the range of the movement is finely controlled and set up within the movement biofeedback. Again, the position of the patient can be changed according to the goal of the therapist. Here, we're looking at extension and flexion exercises, but our goal is balance, and we're increasing the difficulty by adding additional resistance. We're controlling the movements, whether they're adduction, or forward flexion or extension. Here we're looking at a functional practice, again using the movement biofeedback. So the functional practice, which is a stepping movement, has been translated into the movement biofeedback. So instructions are given as to the speed of the movement that the patient has to achieve. We can also finely control the range of motion within the functional practice. So a lunge can be finely prepared so that the patient only achieves a specific range of motion. Again, this repetition of the range and repetition of the speed is finely controlled by the task within the movement biofeedback. This motivates the patient to do repetitions of the customized and controlled exercise. Stand exercises can also be achieved and performed and repeated using, again, the augmented movement biofeedback and the instructions from the task. Squats are also translated into the software, again, allowing the patient and the therapist to finally control the speed and range of movement.
Okay, let's go ahead. Another one is 3D Bluetooth. It's a Bluetooth system, a small system that you can put on different part of the body. You can see here. You can put it on the head, shoulder, forearm, and trunk, knee, and ankle and hip. Just to see a short video shows these elements.
Repetitions of extension and flexion of the trunk using movement biofeedback can be used to achieve upright sitting practice. When placed on the forearm, repetitions of supination and pronation exercises can be achieved within the movement biofeedback. When placed further distally, ulnar and radial deviation exercises can also be practiced and repeated, again facilitating the practice and customizing and motivating the patient to do repetitions with the movement biofeedback. This is also achieved with exercises of flexion and extension of the wrist. When placed on the lower extremity around the ankle, balance exercises can be achieved. Here you see the client practicing within the limits of stability. Additional modalities can be introduced to make the practice more difficult. You see on the screen here that the limit of stability and the amount of cycling and the distance that the patient is cycling between the limited stabilities can be increased. Practice of sensory integration, including vestibular rehabilitation, can also be achieved. With the 3DT placed on the head, the patient can be asked within the software to do controlled head movements. The speed of the head and the instructions to the direction and the speed are dictated by the software. Therefore, the patient can facilitate the VOR.
Okay, now another one is FES triggered movement biofeedback. Short movie, how we can use this modality also. You can combine the FES with movement biofeedback for patients. You can do it assisted active or by therapist or by patient himself. You can do that. Okay, objective evaluation, we talked about that before, that you can do the evaluation and document all this data to see improvement of the patient during the rehabilitation procedure. Now we see case studies about the patients. The first one is TBI rehabilitation in Kennedy University Institute in the United States.
My name is Joan Carney, and I'm the director of the Specialized Transition Program here at the Kennedy Krieger Institute. The program was designed for several patient populations, but one of them being children with brain injury.
Your shoulders, relax a little bit, and let's just review all the way out to the side. No, so come down. It's all the way over, all the way out to the side. Good. I'm gonna reach all the way out to the side. Take one more time. I want you to get your fingers out. Fingers out. That's nice. Perfect. Really reach. Good. You ready?
The basis of this program is that each of our patients, when they leave, will then be able to go back into the community and be involved in the school program and be involved in their families' community activities. So as the children are here, we're working on ways that they can be reintegrated into home, into school, into the community. So that's what we're doing the transition from.
I am a senior occupational therapist at the Rehabilitation program, which are part of the Kennedy Krieger Institute. When we started using video games, which I don't know any teenage boys who don't like video games, the one thing I liked about this technology versus just the commercially available devices is that I had a lot of control as a therapist to change it and make it more therapeutic for him. You know, I could do as much as I could with a commercially available remote. I couldn't make some fine-tuning adjustments that I wanted, such as only having to move a certain amount, also being able to capture when he's trying to use other muscle groups and not just the ones that I want him to move. So that was a nice feature of this. Okay, so it's all green, so it means we're ready to go. So what game do you want to play with this one?
Another one is post-head surgery rehabilitation, also in the United States. We see together now a patient 16 years old, about 6 years after surgery in the head because following a tumor in the head. You see we do it telehealth here, practicing our upper limb, fingers, and also elbow and shoulder together. And we got a much more improvement by using Meditouch Biofeedback also in this patient. Another one is stroke rehabilitation, also in the United States. 10 years, stroke patients, 10 years after the stroke, chronic problem. We use hand tutor for hand rehabilitation and also arm tutor for shoulder and elbow, and also the leg tutor for lower limb. Now you see the hand rehabilitation by Telehealth. Alan is there in the screen that gives them instructions how to do that. And also Alan gets feedback by the system in Israel about the motion and accuracy of the movement. Here we are focusing on the lower limb, stability on the knee, and the weight bearing on the right leg. Here, assisted active flexion extension of the shoulder by external assistance, and here self-assisted active, as we see here, and we go ahead, and then we see active exercise that he couldn't do that before. Okay, here is very interesting things. Prosthetic functional practice. This product is based on EMG, robotic prosthetic that the fingers are flexed and extend by EMG coming from the biceps and triceps. And the aim of this treatment was to train the patients how we can optimize this kind of signals coming from the biceps and the triceps to get better control of the robotic hand. As you see here by the hand tutor, we try to detect the movement of the robotic, to analyze that and to see how they are controlled. And then we can do practice by functional practicing, like here, getting a cup and release that. And to take the range of motion for doing this task and giving him instructions and also feedback to do it more optimized and more controlled movement. Actually, to help him to control his signals coming from the biceps and the triceps in more resolution, more accurate. Yes, of course.
So what you do, you're taking this as a functional task and you're setting up the range of motion, which is then, as I said, translated into the system. So he has to repeat the exercise practice using the augmented feedback, but under the range of motion that we did with the functional task. So he's learning a type of proprioception that he doesn't have. So he's learning feedback from his triceps and his biceps to actually do it, and obviously coordination between elbow flexion and the grip movement. And all that is coordinated through the feedback.
Okay, thank you. Another one is post-shoulder fracture practice. We starting from assisted active, as you see here, and then we go to assisted active and active practice of the shoulder. Okay, because we have limited time, I try to do it fast and go to another slide. Here is we see a CRPS. By the gaming, we try to distract his attention to the pain and forcing him to get more range of motion of the fingers and the wrist joint. Very good results from here. And now, lower extremity stroke patients, beside in the last slide also. Okay. Ali, you want to talk about that?
Okay, I will. So just a little bit of a summary of what the system is. So we've seen the devices in the system. The devices are all the wearable devices, the wearable ergonomic devices. And as we said, it doesn't give you any restriction to your range of motion, okay? And because they're wearable, you can wear them in any position. So it's the goal of the therapy, if you want to work, for instance, in a standing position or a lying position or a sitting position, having a wearable device doesn't restrict you to that at all, okay? And it doesn't restrict the range of motion of the patient. You can use any range of motion, which is going to be your therapy goal, okay? Also, it's not restricted by the range of motion of the patient. For instance, the hand tutor, you're not limited to a certain amount of wrist extension before you can put the device on. The device can be put on even if you've got a very limited amount of wrist extension. And because you have a system with devices that you can put all over the body on all the joints, again, you have a very, very broad and large range of therapy options and therapy goals to work with. Now the technology, because it's dedicated rehabilitation technology, is very sensitive. So it can pick up very, very small movements of range of motion, okay? And that allows you to repeat very, very precise movements. So for instance, when you're looking at fine motor practice, you can pick up very, very fine movements of the fingers and repeat those. So you're actually seeing the augmented feedback of those precise movements. Now it's very important. This is real time for the motor learning. So there's no delay in picking up the movement, picking up the very precise movement, and getting that augmented feedback from the screen. And what's very important when we're looking, and my colleague said this as well, is that you have the ability to document and report your treatment. So that's right from baseline, right from evaluations within the system. So we can document it, and we can then report it to our colleagues, report it to our clients as well. Okay. Also, motivation. We talked about motivation. Now, it's a dedicated system, but we have a very large large range of tasks that we can use, and each task can be customized. So that it's got limitless amounts of treatment options and treatment gains, if you like, within the system. Being able to use the devices because they're wearable ergonomic devices, and being able to introduce other modalities, other objects as well, gives you the ability to make task-oriented or task-specific training, as well as the repetitions of isolated movements.
Let's talk about that.
Okay. Now, a little bit of background to some sites that we have in the US. My colleague showed you a video about Kennedy Krieger. We have in several departments in Kennedy Krieger. And they're also, during the COVID-19 situation, they're also using the system for telehealth as well. So what that means is that they're actually supplying devices to their clients in the community who aren't coming into the outpatient facility. And they're doing the therapy sessions using the dedicated platform that we have, which is also a dedicated telehealth platform, to be able to continue and to be able to give follow-up and be able to continue, and most importantly, to be able to bill for their therapy time and their therapy sessions, even though the client's not coming into the clinic. We have the same in Boston Children's Hospital, and that's very interesting because that's also an international program. So in the States, it's also a multi-state program, but also an international program. So they have clients from all around the world as well. And then another site we have is a neurorestorative in Texas, which is also doing telehealth. So we're getting more and more sites interested. These are sites that are experienced with the software and with the system. And because they're experienced, they can understand that it's an easy, if you like, play out or to increase the potential to give the devices to clients in the community as well. So going from a clinical product to used in the clinic, also to a telehealth product as well.
Let's say, go ahead, yeah.
Okay, so now we've talked about customization. So obviously when we're talking about customization, we want to be able to customize those tasks to our goals. Now our goals might be functional goals, for instance, balance. They might be balance and gait, for instance. They could be particular indications. So we're looking at vestibular rehabilitation, or we're looking at proprioception rehabilitation, or we could be looking more at working on specific abilities. So we're looking at trying to improve speed of movement, trying to improve range of motion. Obviously, these are indications that we're trying to do to achieve. We're trying to work on our abilities, to improve our abilities, to improve our functional goals.
And cognitive.
Yeah, and cognitive as well, and motor deficits, if these are our goals as well, or joint coordination. So these are examples of abilities that we're trying to improve, and we can customize our therapy within the system to improve these abilities. And also, there's one here, FBS triggered biofeedback. You saw that. That's allowing us to be able to use protocols within the system to be able to use additional modalities for inclusive active assist practice. So, for instance, FES practice.
Okay. Objective reports, of course, documentation. You have reports and to see improvement of the patients in regards to biomechanical problems like speed of the movement and range of motion and motion analysis. Here we can see Tele-Rehabilitation, a short movie about the Tele-Rehabilitation, how we can learn.
So within the Tele-Rehabilitation platform, you've obviously got a audio and video communication, which is a peer-to-peer communication, which all the securities, that's the securities that you need when you're doing audio video with telehealth. You also have the ability to be able to share the patient's screen. So we can set up all the tasks that we're going to be doing. And if you like, empower the family to be able to understand how to do the home exercise practice. So the telehealth session is really a one-to-one session between the therapist and the client, and probably a family member assisting, as you can see the child's mother here, empowering them, trying to teach them how to do the practice, how to do the home exercise practice. And once you've done that, the system also allows you then to set the tasks. So you can finally set the tasks that they're going to be repeating. And once we've done that, we can also check compliance to home exercise practice as well. So it's a complete telehealth system, looking at trying to encourage the motivate the whole family unit to be able to do more practice at home to get better outcomes.
Okay.
As I said, we can do a one-to-one telehealth session. So that's an example of a synchronous telehealth session. But an asynchronous telehealth session is the ability to go in, set up the home exercise practice, have a look at compliance when you're not one-to-one with the patient. So in the States now, you have the ability to do what they call e-visits or virtual visits, and they don't have to be synchronous one-to-one. So you have the ability in the States to build for synchronous and for asynchronous sessions. As I said, we have a specific entry point within the platform for the therapist. So we have a dashboard, if you like, for the therapist, allowing them to see data on all their clients that they're working with, and to be able to do telehealth sessions with all their clients. But there's a separate dashboard that the patient receives. So the patient also receives access to the software, because it's a Chrome-based browser software. But their access is more limited, and it allows them just to see the points that they need. So just to see their home exercise practice, or just to give them access to previous tasks that they've done with the therapist. We have the video and the audio online, which is the peer-to-peer video online, which is very important when you're looking at all the securities. This is specifically designed for HIPAA in the US, but I think across the board, that's more across the board, the securities on a world level as well. As I said, the system allows you to set up the home exercise practice. Now, during a therapy session, the therapist can actually set a task for the family and the client, and they can be playing that task at the same time using their dashboard. And because I have a separate dashboard as a therapist, I can then set up their home exercise practice. So we can do dual tasking within that one session. Once we've set up the practice, that's a good conclusion to actually finish the telehealth session so that we can discuss what our expectations are. So we're trying to build up a mutual expectations between us and the family about what we want them to do in regards to home exercise practice. So that's, if you like, a buy-in that we usually do to finish the session, using the software to show them exactly what task we've set up for the home exercise practice.
Okay, and in the indications, of course, you can use the system for neurological rehabilitation, like stroke patients, CP, head injuries, spinal cord injuries, and other kinds of neurological rehabilitation that need physical rehabilitation using intensive and repetition practice and giving feedback to the patients. Also, pediatric rehabilitation, the same concept as I said before. Balance training, including vestibular rehabilitation and other kind of gait problems, to give him more ability to improve the balance and standing, of course. Vestibular rehabilitation and vertigo by focusing on VOR practicing, that we can do it very customized and very accurate practice by giving the system, because the system allows us to, first of all, to customize the range of motion of the head and also speed of the head moving during the practice, and also gauge stabilization of the target during the practice, and working on the VOR in more details. And also orthopedic rehabilitation, like joint replacement, like a knee or hip replacement or other joint replacement, to giving patients more ability to rehabilitation and giving feedback about this kind of problems. About the certification, the system has certification for CE, FDA, and other kind of certification. So it is FDA 510K, and so there is no any problem with certification. Also, you can use. Okay, I try to do it very fast because 45 minutes. I'm standing on. We are standing on the 45 minutes to show the presentation. Now, I would like to go to question and answer. If you have any question, you can talk about it more details, and we have an open discussion now.
Thanks, Abby and Alan. We've got a question here. How do these devices cope with spasticity in the arm or leg?
Actually, it depends on the severity of the spasticity. If you are talking about very severe problems, severe spasticity, that means the grade 5, for example, in Auschwitz, I would say it is problematic. There is not indicated for this kind of severity of spasticity. But if you use in a little bit low severity of spasticity, it could be very good and indicated, because by controlled movement, you can decrease spasticity of the treatment. Of course, it is for a short time, but it could be very good device for working on that.
So just to butt in, so our goal is during the therapy session to try and achieve movement, okay? So despite the spasticity, so to try and change the position, to try and use FES, to try and allow us to do the repetitions of some movement ability. So once we've done that and practicing during the session, then we hope that we're going to have a follow-up in improved ability. So even though the spasticity level is going to go back again after the therapy session, we're still, because we've reduced it during the therapy period, we can still improve the ability so that we have a better ability to be able to cope with the spasticity. So that's our objective.
Yeah.
Okay. I do find that in clinic here, what we do is we try and reduce the tone. We might use other devices to help reduce tone before we put them on the Meditouch system, and then allow them to be able to participate in a game with the range of motion that they have, or facilitate or support their limb with maybe with a active arm device, or and then put on the arm tutor or the 3D tutor, so that they support it and then their range is better, and then they can do gaming for a longer period of time. But we do see that once their tone increases and they're getting like a real combination and a lot of abnormal movement and the sensor is disturbed, we then stop and then try and retarget their movement and decrease their tone, and then they carry on again. So some of them, as they're working and they participate and their effort has increased their tone, you have to look at the activity and provide support so their movement is maybe a little bit smaller and more controlled. Any other questions?
More questions?
No? Okay. Well, thank you very much, Abby and Alan. If anyone has any more questions or they want to see the device a little bit closer via Zoom, or just feel free to give me a call or send an email to bqi@neurotech.com.au, and then I can show you through the system a little bit more thoroughly. But I appreciate your time, and if anyone wants this recording, I've recorded it and I can send it out to you as well. Thanks again, everyone.
Thank you, and thank you for all of you for the meeting, joining to this meeting. Thank you for your time.
Thank you very much. Bye-bye.
Thank you.
Bye. Bye.